This is Commissioner Winston Barnes. Welcome you to one of our regular discussions. This time around, we'll be talking about Stroke Awareness Month, which is the month of May. And I'm extremely fortunate to have two very special people who are going to share this chat with us today. We're going to talk about the social aspects of it, what it does to families. We're going to talk about the science of it with this doctor of ours, like not just the medical, the science of this stuff, to bring awareness to our residents as to the reality of stroke, especially in a particular segment of our community in this city of ours. But also, we're going to help people to understand what one does when one suspects that a stroke has occurred. We're going to share incredible information with two people who know what they're talking about, and we'll ask them to introduce themselves. Carol?
Hi, Winston. Thank you for having us again. So my name is Carol Hilton. I am the president of Smiley's Voice Foundation. We're a stroke awareness foundation that was founded in 2010 after the loss of our son, Michael Hilton Jr. He was 29 years old when he passed in 2009. So as a family, we got together with our friends and founded this organization to really increase the community's awareness of what stroke does. You know, how to identify a stroke, what to do to prevent a stroke, what to do after one has had a stroke. So we've partnered with Memorial Neuroscience Institute and the many, many doctors, and Dr. Norman Ajiboye is one of the doctors that has been with us for a couple of years now, right? Sharing the education about stroke in the community. So I'm just so happy to have them as a partner.
Of course. We'll come back to that special event that you do every year that you already had this year. It was incredible. But Dr. Norman, tell us about you.
Thank you, Mr. Winston, for giving me the opportunity to be here again. My name is Dr. Norman Ajiboye. I'm one of the neurointerventional surgeons at Memorial Neuroscience Institute, and I'm also assistant professor of neurosurgery at FAU, and I'm the medical director for this primary stroke program.
You're all over the place.
Well, I wear a few hats. But my ultimate goal is certainly to increase stroke awareness and education in our community, and also reduce healthcare disparities and also reduce the stroke burden.
Wow. Yeah. Okay, straight to it. What is a stroke? What's the scientific name for a stroke?
So a stroke, it's also known as a cerebrovascular accident.
See?
Or an
there's a fancy name for it?
Yes,
Yeah,
there is.
there is. So it's basically, the blood vessels that take blood to the brain. So a stroke is when there's disruption of blood flow to the brain, therefore depriving the brain of its oxygen and of its nutrients. So basically the brain cells suffocate. And a stroke can happen either through a clot that obstructs flow to the brain, or if one of the blood vessels ruptures and then there's bleeding in the brain. So those are generally the two types of stroke.
What tends to precipitate a stroke, though?
So there are multiple risk factors that can increase your risk of having a stroke. A lot of it actually relates to lifestyle.
Okay.
So if you're eating food that are not healthy, if let's say you don't exercise, if you have high blood pressure, high cholesterol, high sugar, those are things that can increase your risk of a stroke. Also, things that can cause you to have a stroke could be an abnormal heart rhythm.
Okay.
So if you have heart disease, you can have a clot that forms in the heart, breaks off, and then goes all the way up into the brain. That can cause you to have a stroke. There's also a small segment of people that it could be genetic. Okay. So they have maybe a defect in the wall of the vessel called a carotid web, or they have increased propensity to have formation of aneurysms in the brain that could potentially rupture, or they have a family history of abnormal artery to vein connection called arterial venous malformation. So there's an onslaught of things that can actually cause a stroke.
What does one do, though, Doc, to stay on top of this? You're talking about lifestyles here. Diet, exercise. Right. Talk about that for a minute.
So,
I'll tell you why I asked that question. Sure. I drive by the road, I drive by the parks, and I see people with walking sticks. And my brain says, you didn't do enough exercise before the stroke. That is my automatic response when I see someone, and you can tell they recently had a stroke. Talk about that area of lifestyle?
So, even though the diagnosis of stroke can be very devastating, the silver lining is 4 out of every 5 strokes are preventable. So that's where if you can do or initiate 7 lifestyle choices, you can reduce your chances of having a stroke. Some of it has to do with willpower, some of it has to do with financial competence, and also education about the risk factors of stroke.
Yeah.
So we have to get in the community more and let people know what the right choices are. For instance, trying to, when you go to the grocery, staying away from the middle aisle where there's a lot of the junk food and going to the periphery where you see the healthy food, the leafy vegetables, the fruits. Making one little change in your lifestyle could be quite impactful in terms of reducing your risk of stroke and reducing the potential for disability. Exercising, having a fitness expert or a coach show you what simple exercises you could do. People always think, oh, you have to do rigorous 1 hour intense running every day. According to the American Heart Association, all you need is about 30 minutes each day for 5 days a week of light to moderate intensity. It doesn't have to be too intense. So things in moderation, little power walking or jogging can reduce your risk of stroke and go a significant way of making your lifestyle much better.
And just a comment before I talk to Carol. One of the things I've learned in talking to the specialists I have over the years is that any exercise is better than none.
You're right.
And Carol, this then brings us to something we've talked about over the years. We take so much for granted, and one of your jobs, especially in the last 10 or so years in conversations with me in a different setting, is to have people be aware of the reality of a stroke.
Right.
The PSA that we run on our station talks about knowing the 3 or 5 things to do if you suspect a stroke is happening. Talk about that.
Well, so this is an opportunity for us to do just that.
Exactly.
To really educate the community. And when I come on your show, in the other setting, we do the same. That's why I always have a physician with me, so they can actually give you and the audience a better understanding of the treatment, prevention, and what do they do when somebody presents with a stroke. It was my experience that when my son fell ill, the thought process at that time was for the person to be taken to the closest hospital. Since then, I think that has changed.
Not just the closest hospital anymore.
Correct. So Dr. Jiboye, what can we do if we see that our loved one is experiencing a stroke and the medical services come and say, I'm taking that person to the closest hospital, but that hospital may not be a comprehensive stroke center.
Okay.
What can we do?
So, Carolyn, I really appreciate all that you do because you've turned grievance into empowerment of the community and trying to make changes that are quite impactful in a positive way. And actually, the legislation has also changed since then. So not all stroke centers are created equal. They get tagged either as a primary stroke center, a thrombectomy-ready stroke center, or the one that's been vetted through the most rigorous standard is the comprehensive stroke center. And within the Memorial Healthcare System, which I'm part of, we have 2 of those. So the EMS staff also knows that if a patient has a potential stroke, that they should go to the comprehensive stroke center if it's within 30 minutes of the household. And the reason for that is there are certain treatment paradigms that are not available at other stroke centers that you can only get at a comprehensive stroke center. So if you initially go to a place where they cannot do a thrombectomy and they realize that you have a large vessel occlusion, meaning that there's a big vessel that's obstructed in your brain, then they have to then transport you from that hospital to the comprehensive stroke center.
Time that
and
you don't
that
have
could
to
take
stay.
some time.
And the way you can really fathom this is every minute that passes by when there's an obstruction in the blood flow to your brain, you have 1.9 million brains that are dying. Brain cells that are dying, and they're irreversibly damaged. So we've certainly educated the EMS partners on this paradigm, and it's already legislation here in Florida that they go to the closest comprehensive stroke center if it's within 30 minutes of them. So it's really important for the community to really recognize the signs of a stroke, because we can perfect the technical aspect of taking out a clot from the brain, but if we don't work on the pre-hospital care, then our treatment paradigm is going to be futile. Wow. Because by the time they get to us, they already have a large stroke, and we cannot revascularize or reopen that blood flow to the brain, then our treatment is futile. So the symptoms is made up in an acronym called BFAST. So B, anytime you're having balance problem. I, E for eyes, anytime you're having eye or vision problems. F for facial weakness. A for arm or leg weakness. S for any form of speech abnormality, whether it's slurred, whether they're having difficulty understanding you or expressing what they're trying to say. T means time to call 911. Because time lost is brain lost.
Wow. This is incredible for our residents to understand. I'll tell you why. If you don't know these symptoms, you're lost. But if you know these symptoms, it also empowers you to the point where you are more calm under the circumstances. Because if you have no idea about what's going on, panic could conceivably set in. So that the acronym, as I said, the PSA that we run, it makes it clear. Once you suspect this might be happening, time to do something. But one of the things you said that I like, though, is that the EMS staff has been trained to know which is the appropriate hospital under the circumstances.
Which took some time.
Yes.
To get to
time,
this point,
time is
correct?
important.
Yes, sir. Yes, sir. And that's one thing that's actually also unique to us at Memorial Healthcare System is that on a monthly basis, we actually go out to the different EMS services and we train them. We show them the up-to-date management and diagnosis of stroke. We tell them and show them how to do the RACE score, how to examine a patient, how to actually pre-alert us and let us know, hey, we have someone that potentially could have a large vessel occlusion. Please get the team ready. And we are ready. And that allows us to have really good time metrics, because the quicker we can open up that blood vessel, that could mean the difference between life and death. That could mean the difference between going back to your normal self or being severely disabled and no longer being productive or being available for your family and friends.
And let me just share this with our residents. If you keep hearing Memorial mentioned, free plug, without any apology. I'll tell you why. We have at the City of Miramar an incredible relationship with Memorial Hospital. The one we have here is a little kind of fancy. They call it the Resort. I've heard this. I'm not saying that's what we've heard. But I think it's important that we say that, because it is, I think, of major importance that our residents understand the kind of relationships that exist between public and private entities. And Memorial has been an incredible organization for our residents.
The same holds true for Smiley's Voice Foundation. We could not have touched so many lives without the support of the Memorial Healthcare System. They're there with us every step of the way, and we truly appreciate that.
I appreciate it. And I think it's important for there to be good relationship and collaboration between hospital systems and the community they serve, because that's the only way you can improve healthcare overall.
If you're just joining us, we're talking with two incredible people. We're looking at the reality of stroke as we observe Stroke Awareness Month, which is the month of May. Doc, talk about some of the technology that has changed over time, because sometimes I'm hearing these things, I'm saying these things not even possible, but they become the rigor now, they're commonplace.
Yeah, so I mean, the technology is changing at a very fast pace, and I think neurointervention, what we do, has one of the fastest changes in technology of any medical field. 25 years ago, there was really no good treatment of stroke. They usually will end up leaving the patients in the hospital. Most of them would die. Back then, the third leading cause of death was stroke. Now it's the fifth leading cause of death, meaning that we've certainly made a lot of advances. Yeah. So 20 years ago, the NINDS, part of the NIH, came up with IVTPA, which is a clot-bursting medication that actually revolutionized the care of stroke in the country. So if you and this is why time is also brain, you have to give it within certain hours, within 4.5 hours. Because outside of that window, there's high likelihood that the medication can actually cause it to have a big bleed in the brain. So if you come in within 4.5 hours and you meet other parameters and there's no contraindication, that's a medication that can be given to you to basically dissolve the clot in the brain and restore blood flow to the brain. Now, the pitfall of that medication is some people have extensive clots. We have sometimes seen clots that extend all the way from the heart or even from the neck all the way up into the brain. And this medication cannot handle such a clot. So now, over the last 10 years, we came up with a method in which we can actually physically go up in the brain and pull the clot out. And the beauty of it is you don't have to open up the skull. We can go through the hand or we can go through the leg.
Doc, stop.
It's like sci-fi, right?
I have a friend who she went to do a procedure on her eye. Doc, they put something through her abdomen to her eye, and the photograph I saw is just incredible.
Isn't that amazing?
But Doc, these blood vessels are tiny. How does this thing go?
I know. We have catheters that are so small. Some of them are like 1 millimeters in size.
Wow.
We basically get a catheter, which is a hollow tube. We put a wire through it, and you get access through the vessel, navigate it up through the blood vessels all the way to where the clot is in the brain.
You do that, Doc?
Yes, sir.
Oh my God.
And it's not just me. We've got a great team that do it together. So we get it up there, and then using negative aspiration suction, and also using a stent retriever on a stick, we physically pull out the clot all the way out. And 95% of the time it's successful. We sometimes call it the Lazarus effect. Someone comes into the hospital, they're comatose.
Yeah, they're dead.
They're almost dead.
Yeah.
You basically, on the table while we're done with the case, they're waking up, they're like, Doc, they're like, what's going on? Where am I? I thought I'm supposed to be at home. They're back to normal.
Wow.
It's amazing what technological advances have really achieved over the last few years. Now we've even perfected the technology to be able to do it on patients of all ages. We do it in kids, we do it in adults. We give people the opportunity to return back to their baseline, return back to their loved ones.
And I'm scared now that we're probably telling people, it's okay, no problem, because we fix you. We don't want to have to fix them.
That's true.
4 out of every 5 are preventable.
Yeah.
The goal is try not to get on that table, so you got to start early. There's 7 lifestyle choices,
And I think that is something that we have to underline. I'll tell you why. Most of us come from a different kind of cultural orientation. Our practices are different. The foods we eat that we have loved for most of our lives, some of them are not the best we should be eating. What if you talk about that part?
Yeah, there's going to have to be some paradigm shift.
Yeah.
We have to change the way we think. We got to go back to those whole food, natural, organic, unprocessed food.
Yeah.
Fruits and vegetables. Anything that's processed is quite dangerous, to be frank with you, because it just promotes inflammation within the blood vessels, and it's that inflammation that clogs up the vessels and causes a stroke.
Because I have another good doctor friend of mine, and he says there are certain problems that we as a specific community are going to have because of the foods that we eat. We love it, delicious, but there are alternatives. Because one of the things I like to talk about is the foods that are prepared Italy. And I can't give a free plug here, but there is a particular outlet that the very smell of the food makes you, and there is no meat whatsoever in it. And I think we have taken, to a certain extent, people in our community who live that kind of lifestyle and are doing better than most of us health-wise. I think we've taken it for granted that, hey, that's kind of out to the... But hopefully, and gladly to a certain extent, people are moving towards that natural kind of diet, which is ideal if we're going to try and prevent things like a stroke.
Yeah, I agree.
Talk again, though, and I'm fascinated, and Carol knows this, I'm fascinated by the science of this thing. When you talk about some of the procedures, okay, someone is brought to the hospital, you see that the alternative here and now is surgery. When you wheel this person into a theater, how long would you have them in there, for example?
So what we do is called endovascular thrombectomy when it relates to trying to take out the clot in the brain. That's the procedure. It can take anywhere between a few minutes, 10, 15 minutes, to sometimes maybe at the most 45 minutes, 60 minutes. A lot of times from puncture to reperfusion, meaning from when we actually get that needle into the blood vessel to opening up the blood vessel, the average is usually 15 minutes, 15 minutes.
Which, that's incredible though, because what it does, it falls in line with that whole need for time.
Correct.
Use time properly.
That's why we go through a rigorous training of several years, to be able to perfect our art and the technique, to be able to do it in an efficient way. There's no reason to be wasting time. The ones that take longer are sometimes the one in which you can't get the clot out in one piece, or it doesn't open up, because there's sometimes 5 to 10% of the cases where it's unable to open up because either the clot is stiff and it's hard, or you don't have the right devices to be able to completely open it up. So, but the success rate is still over 90%.
It brings us back again to being treated at a comprehensive stroke center and the importance of that. I have to come back to that because that is so important for us to know and to advocate for that, just in case you're someplace that they may not have had the training. I'm pretty sure there's nowhere else at this point, because I know that you've been actively in the emergency management services and educating them. So we're very thankful for that.
Which brings us to the other aspect of training for our fire rescue people. Talk about what happens in that situation.
Train the fire rescue?
Yes.
So usually the EMS staff, they get some basic training to be able to do what they do. But what we do, at Memorial is we physically go to the fire stations to show them how to do quick exams, to be able to triage patients, and then to let us know ahead of time before they start bringing the patient to the hospital that there are certain findings that they see on the exam, because there are certain things that we can see on the exam that makes us or clues us into as where the blockade is in the brain. So if we think it's a very, very small vessel that's blocked, then those are cases in which they might not benefit from trying to put a mechanical thrombectomy in or doing a case like that. And it might be more risky than beneficial. So those are the ones that might benefit from the medication or just medical management. But if they have certain other findings, like they're looking to one side, or they're having difficulty with language, things that we call cortical signs, in addition to other findings, then we're thinking there's an occlusion of a large vessel. They let us know ahead of time so we can start preparing our operating room ready for the patient before they get to us.
Which brings me to this, and I think we talked about it last year. I'm convinced it's essential, it's vital for our residents to know, for example, that treatment actually starts once those guys come to your door. Because more times than not, they're communicating with you in the hospital on the way to.
Correct. Actually, I think treatment starts before it ever happens, which is have a big focus on prevention. So have start right now, at whatever point you are, start right now with those 7 lifestyle choices. Start enacting those. But then if you happen to have a stroke, immediately call 911. And the treatment will start right there because they're already communicating with us before they get to the hospital.
Because you see these guys on these things and they're talking and they're chatting. They're talking to the hospitals. Wow. And sometimes they're talking directly to you.
Of course. Sometimes they have our phone numbers. They can do FaceTime with us. We have that capability as well.
Wow.
They're like, hey, doc, what do you think about this stroke? Do you think this is something very serious or is it minor? Yeah. And we certainly can help triage them over the phone as well.
Incredible. And Ms. Carol, we have to talk about that special event that comes up every year.
Oh, are you talking about our health fair or the fundraising?
Both, okay. Kind of combined together.
Okay, so the next event is going to be on June 1st, which is our Stroke Awareness Health Fair. And we're going to have Dr. Jiboye as well.
Right.
And he's going to be one of the keynote speakers.
Okay.
And we're going to have a physician's panel. It's going to be June 1st at the City of Tamarack Recreation Center.
Okay.
So they're all on board, and we're in the planning phase right now. So we hope that our community comes out. There'll be free health screenings, and I think it's going to be very positive for the community.
Good, good. And that is one of the things that has made your journey so impressive and effective, is that we do the banquet, we do stuff like this, but you also bring it to the community.
Absolutely.
And I cannot but help mentioning the incredible help you've gotten from these doctors over the years. I mean, you know I'm crazy about all this science, but
Absolutely.
I have learned so much listening to these specialists talk over the years, and I am just thrilled that as a commissioner in this city, I'm able to bring this kind of information to our residents, because I know for a fact that our residents have learned so much just listening and watching us for these past few minutes. But it has to be an ongoing thing where we continue to bring this information to our residents. And I want you to also put them on notice to support the banquet when it comes
Oh,
up.
absolutely, absolutely. And I'd be remiss if I did not thank Dr. Brijesh Mehta. He is the medical director for the Neuroscience Institute at Memorial as well. He's been on board with us for the past
Forever,
at least 8 years.
Yes.
At our health fairs, at our fundraising banquet, and our fundraising banquet gala is going to be in November this year. We don't have the date yet, but I'll let you know soon.
Of course.
And that's when, we get to really thank the people who have supported us and also share, again, information. We never have a gala unless we have a physician speaking
Speaker.
and also providing education.
And what is cool too is the doctors bring some incredible information when they give that guest speech. I'm just fascinated, so I'm listening to everything that happens. But the doctors are smart people. Plus, they're busy people, so they never talk too long. That much we discover. But no, I thank you guys so much for spending the time with us. I want you both to talk about those lifestyle changes before we wrap up, Doc.
Okay. So the 7 lifestyle changes. Number 1, eat healthy, maintain a healthy weight, do not smoke, exercise, make sure you don't have high blood pressure, and if you do, see a specialist. Make sure your blood glucose and your blood cholesterol are within normal limits. Those are 7 important lifestyle choices to make.
Carol, your final comments.
Yeah. My final comments is, again, thank you for giving us this opportunity. Thank you to Dr. Jiboye. Thank you to the Memorial Neuroscience Institute for their tremendous support over the years and for educating our community on stroke prevention, what to do when, how to recognize a stroke, and to get the appropriate treatment. Thank you.
On behalf of all of us here at the City of Miramar, I'm taking it as this really special opportunity to thank Carol Hilton and Dr. Norman Ajebo for sharing this incredible catalog of information that is so essential for our community. And the reality is that we are a community that is aging, and this kind of information becomes more vital as you age. And I also want to tell our residents, we have the best set of parks in the entire, at least Southwest Broward. Go to the park, get some exercise. It is what is going to help us continue to live in this incredible city of ours and enjoy what it has to offer. I thank you again for spending time with us, and I thank our guests for sharing with us.
Thank you.
Thank you.